Hi everybody, Dr. Anjana Bana here and welcome back to my YouTube channel. I'm here with Nicole from AQ Solutions. Thank you for being with us today.
Thank you for having me.
So Nicole is going to be discussing AQ Solutions and doing a treatment on Sheetal. So we'll get into that when we get into the video. I'm really excited to discuss and to talk about AQ because you guys have seen a whole lot of videos. We were at one of their training workshops where we were doing the filler and the skin booster. Today we're going to get down to the nitty-gritty, the origins of AQ Solutions, which is the growth factors, and discussing what growth factors are. So without any delay, let's get on with it. So Nicole, what are you going to do on Sheetal today? What are we doing?
So today we're doing what is known as a GFIT treatment.
Okay.
Otherwise known as a growth factor induced treatment.
Okay.
We're going to be using our AQ recovery serum, which has over 200 skin-specific growth factors. These are isolated growth factors, meaning that they will only work on the actual skin condition. It will normalize function as growth factors work similar to that of an adaptogen, where we are both increasing function, but also switch off cells that are not functioning or working at their best.
So enhancing cell function and decreasing cell dysfunction. Yes.
Exactly.
Okay. All right. So
in all, we are normalizing skin function back to pretty much between a 22 and a 25-year-old.
Oh, okay. So reverse aging. Yes. And then Benjamin buttoning. Yeah. So, Nicole, one of the things when you came to first talk about this to me, you mentioned the quality of the growth factors. So now you get growth factors in creams. They've also got a recovery serum that is a topical application that's great for wound healing. But you see growth factors all over the place, like plant growth factors or Edelweiss stuff from apples. So if you can just give us a little bit, like, what's the difference between this and a growth factor from a plant?
So very importantly, these are cloned human growth factors, meaning that they are identical to the human body.
Okay.
They are identical to what our skin is used to. When it comes to talking about our human growth factors, some of the questions we ask our clients is, if you were, God forbid, in an accident and needed a blood transfusion, you wouldn't be drawing blood from an apple.
Yes.
You wouldn't be drawing blood from a sheep. You would be drawing blood from another human being. And that is why we get donated human growth factors. And ideally, your skin already recognizes this, which means it is going to work almost immediately. You'll see within the treatment today that inflammation scale that we are ultimately gauging the wound healing response on, we naturally need that wound healing response to get the collagen synthesis going, to get our own stem cells into that area. But the growth factors themselves are going to reduce that inflammatory side, but enhance the fibroblast activity.
Okay, cool. So exciting. So Nicole is just cleansing the topical anesthetic off, and that has been on Sheetal's skin probably for about 30 minutes. So you can also use EMLA. Hey, Nicole?
You can also use EMLA. We are stamping up to 0.75 mils deep.
Okay.
But because of the needle itself, it contains 140 needles in the head. The injury is quite
injurious.
Yes, very
in a controlled. It's discomfortable. Discomfort, if that's a word, not discomfortable, uncomfortable.
It's uncomfortable.
There's some discomfort.
It's more uncomfortable than a microneedling.
Okay, because of the stamping.
Because of the stamping and the amount of needles that we are injuring the skin.
Okay, but a controlled injury, and then the more microchannels created, the more infusion of the growth factors. So this is it, eh? It's the derma stamp system. So, and is it an adjustable, or is this the?
It's not adjustable.
Okay.
So that is a 0.75. We have up to 2.5 mils. Naturally, depending on which part of the body you are working on.
Okay.
But in this instance, our skin we really only need to get to 0.75.
Okay. So that's already in the dermis.
Exactly. And we want a small amount of pinpoint bleeding because the blood is what is going to carry our own stem cells, and the growth factor is what's going to activate those stem cells to do their job. Okay.
Oh.
Yeah.
Thank you.
I'll be the assistant today.
Sorry, the fumes are
No, it's fine.
Yeah, it's strong. It's quite a strong disinfectant. But better
rather safe than sorry.
Do this, and you can pop it in here.
Thank you.
Okay. It's capped.
Okay, so the first thing we're going to do is we're going to apply the growth factor to the area that we are working on.
Okay.
So we always start in the forehead.
We start in the forehead because it is the most sensitive area, and just to get that sensitive area done with so we can concentrate on the rest of the face.
I like to say, think of the growth factor as the bread to the sandwich, and the stamping is almost the meat. Okay, so we're causing micro injury to the skin, as we would with any form of collagen induction therapy. As you saw on the stamp, there's almost like a rubber cushioning, which allows the stamp to measure a certain depth with the skin. As we crisscross, we're almost getting double the amount of needles. It's quite interesting when you're physically doing the treatment, you can feel areas, wrinkles, rough texture.
Yes.
It's almost like the skin snaps underneath the stamp.
Yes.
This is going to help, obviously, with collagen induction, lymph. It's going to tighten the area, very much indicated for dark circles, puffiness.
I see you aren't really doing the brow. So when you're doing a treatment with these skin-specific growth factors, if you go over the brow, does it have any?
No problem at all.
Okay.
So when it comes to hair, our hair, Dr. Al-Qatari has isolated the growth factors specifically for hair growth.
Yeah, because you have a separate treatment for hair.
Exactly.
Yeah, but using the same GFIT, like the stamp. Yeah.
Can you open your eyes for me and look all the way back? I know this might make you tear a little bit. You want to get right underneath. You okay? All good? The preferred or recommended protocol is 1 GFIT every 2 weeks, repeated 4 times, with the patient using our active serum, which has 45% of those 200 growth factors within it, in between their treatments. This will give the skin a full cycle of rejuvenation. And naturally, I mean, the active serum, even though it's only 30 moles, 1 pump goes a very long way. It's applied during the day when the face is most active. And then we like our patient to come in and review their skin, their results. Most patients generally like to do a GFIT once or twice a year to keep that skin regulation going. But very importantly, one needs to assess the patient and their aging scale.
Yes,
so
of course.
Depending on the patient's aging severity or pigment severity, 2 courses might be needed continuously, and then we break.
And then for, say, Sheetal, 30s,
I would
looking 20.
With skin like this, I would only probably recommend once or twice a year. If not even once, just once a year. How are you feeling? Nice and calm? Okay. So there's a little bit left. I'm just going to rub it all over. And then we're going to apply our intensive moisture mask. Which has soothing and calming ingredients in it, but most importantly, it is also got growth factors.
This is the intensive moisture mask. Yeah. Can I open it for you?
Thank you.
You can feel there's lots of stuff,
yeah.
serum in this mask. So I'm sure the rest you give to the patient to take home.
Absolutely. You can put the mask back in, into the bag for them, or you're welcome to draw up the rest of the serum into a syringe and then give the patient their mask in the little baggie for them to apply. I would recommend keeping it in the fridge. You
can I hold this? Let me just put on some gloves. Yeah.
So it comes with ultimately 3 little layers, and we want the textured layer to go onto the skin.
Okay.
It's going to be nice and cold.
Very calming after.
Thank you. How are your lips feeling?
They're actually fine. Everything's just a little bit warm and tight.
So Sheetal was just saying that she's feeling fine. It just feels warm and tight, which is perfectly normal after a treatment like that. And then this is all the serum. It's the full syringe actually that came out of here. I think it's nice to actually give the patient this to take home. Yeah, and then this is the same syringe that had the growth factors in it. So you have a little bit of growth factors. Yes. Yeah. Okay. Okay, thanks guys. Thanks for joining us for this video. And this is Sheetal's take home mask serum mixed with some growth factors. Thanks, Nicole. Thank you so much for
having us.
Yeah, coming through, doing a treatment and chatting about growth factors. Nicole, I know Nicole for years. She's super knowledgeable about skin, about aesthetic treatments. She's got a massive amount of knowledge on all things aesthetic. So it was a real privilege having you. Thank you so much. So if you guys have any questions about this treatment, drop them in the comments down below. Like, share, and subscribe. And also, you can get onto AQ Solutions South Africa on Instagram, and you guys are very responsive. So you're asking them anything you need to know about the growth factors. Thanks, guys. Bye.